Mercy Medical Center is a faith-based organization. We serve to further the healing ministry of Jesus, and how we do that is through our mission, vision, and values. Our values speak highly of respecting human life in all of its form, whether that's a coworker, a patient, or someone who we've just come into contact with. Some of the services that we've been able to offer through generous donor support include the Wig Boutique, which is for our patients who are living with cancer, the Reach Out and Read program, which is a reading program for the youth in our community, and of course, what is core to our central mission is service to the poor. And that service doesn't come without a cost, and so the philanthropic donations that we receive help offset that cost of giving and donating that service to the poor in our community.
Palliative care is a special kind of care for patients who have serious medical illness. And when we think of serious medical illness, it could range from heart failure to COPD to cancer. And the focus is to help patients with these various serious illnesses cope with the illness, have the best quality of life possible, while providing them some relief from their illness. We help provide them resources that would help them go through their illnesses, and it's appropriate at any age and at any stage, and palliative care can happen along with curative treatment.
My husband was diagnosed with pancreatic cancer. It worked. It worked for us to be part of palliative care, and I'm so grateful. When you enter palliative care, you realize you're not alone, and you start getting the help that makes things more comfortable. You have time to breathe, you can relax, you understand you're not the only one, and you are treated like an individual. The palliative care program really helped me through what I needed to get through during this part of life. The program needs to be here and needs to grow and expand.
Everybody has a story. Oftentimes there's not a lot of people that are interested in listening to that story and taking it seriously. One of the things that I hear from patients frequently here in the hospital is when they're talking about the staff, they say, you know, it's really kind of amazing. People seem to care here. And I think that's what sometimes makes us different from other places, that we're not just doing a job, but we're providing care for them. And the mission is to live out the healing ministry of Christ. And Jesus, we think of him as a religious figure, but he really was less of that, as just a real person. And when he was with people, he wasn't demanding that they be a certain way or do a certain thing, but he was just caring for them. And I think that's what I'm called to do, just being there and kind of journeying with people and caring for them.
Being a faith-based organization is very helpful because the mission and values of the organization help drive a lot of what we do. The spirituality aspect, whatever it is, the fact that we're a Catholic organization doesn't mean those values have to be imposed. We work with whatever the person's spirituality is. Some people say, you know what, I have none, and we're okay with working with that. But you know, that's at the core, because we realize that everybody has something that they connect with spiritually, and we think that's very key, especially when you're going through an illness, to provide that support.
For nearly 125 years, Mercy Medical Center has thrived in large part due to the community support that we have received. We are so thankful for this support, and we look forward to providing person-centered care to each individual of our community in the future.